Did you know that 94% of people don't use their inhalers correctly? My name's Debbie Rigby. I'm an advanced practice pharmacist and the clinical executive lead at the National Asthma Council. I'd like to talk to you today about a new resource available for pharmacists when you're dispensing inhalers to our patients. There's basically two different types of inspiration or inspiratory flow rate with inhalers. And that inspiratory flow rate has been shown time and time again as one of the most critical errors that people make. And that directly impacts on the amount of drug that is inhaled and the lung deposition, and hence the outcomes for people for their respiratory conditions. So if we can support patients to know what the appropriate inspiratory flow rate is, I think we're going to get better outcomes for our patients with asthma and COPD. The two different types of inspiration, and really trying to simplify it. We've got so many inhalers now, it is confusing, and many people will be on multiple inhalers. So they might be on a dry powder inhaler, as well as a PMDI, a metered dose inhaler. And they have different inspiratory flow rates, and that's really challenging for people to remember. So if we can apply a supplementary label to the inhaler, that's a prompt and a reminder when a person's using it, probably hopefully every day with their preventers, because it can be confusing. Remember which way to breathe in, with each device. So, as I said, there's two different types of inspiratory flow rate. One, you need to breathe in slow, steady and deep, and that's for PMDIs, metered dose inhalers, and our soft mist inhalers, which is the only one we have is Respimat. So it needs to be a slow, steady inhalation over 3 to 5 seconds. And with PMDIs, that's when they're not using a spacer. Ideally, most people should be using a spacer with a metered dose inhaler. But if they're using it without an inhaler, it needs to be that slow, steady, and that's why I say it to patients, slow, steady inhalation. Because if they breathe in quickly, a lot of the aerosol is impacted on their back of their mouth in the oropharyngeal area. So by breathing in slow and steady over those 3 to 5 seconds, you're going to get greater percentage going down into the lungs and that greater lung deposition. So that's also true with the Respimat inhaler. It needs to be a slow, steady inhalation. And it's probably easier for patients with the Respimat because the aerosol comes out much slower than a PMDI. So therefore people don't tend to breathe in quickly as they do with the PMDI. But that slow, steady inhalation is critical for optimal lung deposition. Whereas with the dry powder inhalers, the DPIs, it needs to be a quick and deep inhalation over 2 to 3 seconds. And the reason we need to have that really hard, forceful, quick inhalation is because it's a powder. It's a dry powder inhaler. There's no propellants in DPIs. And it's mixed, the active ingredient is mixed with lactose as an excipient. So we need to separate the active ingredient from the lactose. You're not going to breathe the lactose down. It is impacted on the back of your throat. But the active ingredient, with small particle size, 1 to 5 microns, needs to be separated from the lactose. And you need that quick, forceful inhalation to help that separation, the deagglomeration of the active ingredient from the powder. So with DPIs, it's a quick and deep inhalation over 2 to 3 seconds. So these stickers that we've developed jointly with PSA and the NAC, one says inhale quick and deep, and clearly that's for DPIs, and the other says inhale slow and steady for the PMDIs, your metered dose inhalers, as well as the Respimat inhaler. We've also developed a sticker that says return unused inhalers to the pharmacy for safe disposal. And I think that environmental consciousness should be top of mind for everybody, because many people will just put inhalers in the landfill in their normal rubbish. So they can be returned to the pharmacy for that safe disposal. So these stickers are available now. I'd really encourage you to add them to inhaler devices when you're dispensing. When I'm doing my home medicine reviews, I take some stickers out with me, and in my counselling with the patient, I'll end with putting a new sticker on the label on the inhaler. There is sufficient space on the inhalers. You can figure out with the ellipters, for example, I'll put it across the bottom. With the PMDIs, they fit nicely around the inhaler there. And then across all of the different inhaler devices, there's usually room to apply that sticker as a reminder to the patient when they're taking them.